Thank you very much, Sona. Always a pleasure to hear you speak and to learn more about the work that you've been doing with the various research and guidance documents that your center's been producing. So thank you for that. There's been some interesting questions and responses and comments shared in the chat box. So Sona, I'm thinking that while we take a few questions at the beginning of this period here, you might want to just catch up on some of that as it relates to your presentation. And we'll start with a question to Rebekka. How does that sound?
That sounds great. Thank you.
Okay, thanks so much for everything. And Rebekka, there was a few questions in the chat box about the health assessment. I think there's a lot of interest in that in terms of when it might be out. There was another question that was not directly about the assessment, but was posed to other people on the line as to, are others engaged in climate programming? I asked if folks on the line were engaged in vulnerability and health assessments, and we had some comments and responses there. And so I thought, Rebekka, if you have any sense of how both public health units and community health centers, because one of the questions was about community health centers, are engaged in climate programming and assessments, that would be great to hear from you, and also any sense of when the assessment would be released.
Yeah, absolutely. Thanks, Pema, and thanks, Sona. That was a great presentation. So in terms of the release of the report, we do anticipate to have it released this coming summer, so late this summer, probably late August or early September, so stay tuned for that. In terms of the health authorities and community health centers that are involved in climate change work, I mean, I think that's great. I've been looking at the chat box too, and it's awesome to see the various organizations that are starting to really ramp up efforts on understanding climate change. I will put in a little plug for our Health Adapt program that Health Canada has recently launched. We've provided funding to 10 health authorities across Canada to essentially conduct local climate change and health vulnerability and adaptation assessment. And I think I've seen a couple names on the line that are Health Adapt funding recipients, which is great. And we also have a community of practice where there are health authorities that maybe didn't receive funding are also still being able to learn from the various presenters that we have and promising practices that are coming out of our Health Adapt projects. It is a pilot project right now, so we're hoping that in the future it will be able to be expanded. And then I think, was that all the, does that answer those questions, Pema?
I think so, Rebekka. I think so. But I did see some other comments in the chat box, and I'll just flag that for participants that if you're looking for people to connect with about engaging in climate change programming, advocating more upstream rather than downstream, and also learning more about equity and vulnerability assessments, there are some good comments in the chat box and names that you can follow up with offline. I'll just flag that for everybody. And of course, you can always contact me. I'll make sure that the email address for the NCCDH is at the end, and I'll leave my email in the chat box as well. There's been a few different questions or comments about the concept of resilience and the challenges in both language relating to vulnerability and resilience. And I'm wondering if, Sona, you'd like to respond to some of that conversation around resilience, but also maybe speak to if there's work that you can speak to with your framework about how to advocate, how it can support advocacy or more upstream action for addressing those root causes of inequity that drive climate-related vulnerability.
Sure, thank you, Pema. I'm happy to, and I appreciate the thoughtful comments and questions. I absolutely agree that there is resilience and adaptation, as I mentioned earlier, are used very interchangeably, and climate adaptation tends to have a more kind of policy wonky feel to it and can be very inaccessible for folks not working on policy or in these spaces to know what that means. And at the same time, resilience is a buzzword these days and can mean so many things that what we find is really helpful is to, in the context that we're working in, provide some examples of what resilience means for our work. And knowing that, you know, there isn't one strategy to reach resilience in communities, but that, as I shared during the presentation, because of systemic injustices, these inequities are showing up in the environmental space, in health inequities, economic inequities. And so our resilience strategy is really about tackling multiple inequities at the same time. And I think, you know, going into the comment that folks had about what are some upstream kind of policy levels to think about in addition to the more downstream ones, I think it's a great question. And one thing that our organization is working on to kind of achieve more of an upstream approach is working on legislation to establish a statewide Office of Racial Equity. And the vision for this office is that it would identify what policies and practices are already in government across different issue areas, whether it's climate, health, policing, and so on, that contribute to or exacerbate racial disparities, and how can we develop proposals to address them, you know, trying to get at more of a systems-based approach versus just putting Band-Aids on the symptoms that we're seeing of these systemic injustices. That's something that we are just now starting to work on. We're very excited about this, as it'll be a way to not only look at the racial disparities that we're seeing in our state, but also make sure that we're de-siloing these different sectors and drawing out the intersections that public health has with climate change, as well as so many other different sectors, whether it's policing or economics. And another quick example I wanted to share is that a few years ago, our organization worked on a policy to establish this really transformative program. It's a grant program that's known as the Transformative Climate Communities Program. And the program essentially aims to provide communities at the neighborhood scale with multiple benefit kind of programs. And the reason we wanted to work on this program is because right now, if you are at a community-based organization or in an under-resourced community, and your community needs maybe recycling in addition to affordable housing and better kind of active transportation, whether it's bike lanes or something else, a lot of these communities have to apply for multiple grants, which can take a lot of capacity, can lead to a lot of planning fatigue, and they may not have the technical resources needed to do this kind of work. And so we worked on a policy known as Transformative Climate Communities to streamline all of that. And essentially a community would apply for one grant and name all of the different elements they want to see in their community to transform it. That can provide health benefits, that can create jobs, that can mitigate air pollution, so that we are trying to kind of, not work on one problem at a time, but really think about ways to tackle multiple inequities that we're seeing.
Thanks, Sona. And a lot of what you're saying is resonating with me. And something that I've read recently, I did share this in the chat box, but it was a little bit earlier and it may well have got lost. It's a commentary by Nancy Krieger, who's a kind of well-known health equity scholar out of Harvard. And he wrote about how, for those of us in public health, and I'm kind of reading from her paper here, one way to contribute our skills and insights to the changes so urgently needed in both society and overall and in the institutions that we work is to start by respecting the leadership of a myriad of groups and coalitions nationally and globally. And she talks about other social movements such as the Black Lives Movement, the Poor People's Campaign, the Green New Deal. So while she's writing in, in the U.S. context, I think that likely resonates with aspects of what you're saying, Sona, and also with our Canadian public health practitioner audience. that there is opportunity to work in coalition with, work across sectors with, and advocate with in a more unified way others who are looking at addressing more structural factors and root causes of inequity. So there is certainly a public health role for that, and we at the NCCDH certainly try and provide resources to help with that kind of taking leadership and advocacy on both structural and social determinants. So thanks for your response there. We have quite a few other questions that have come up. I'm just looking for one here for Rebekka. And sorry, I'm just going to scroll through here. I did see one about that was kind of interesting on how, believe it was from Gary, on how the story that we kind of tell ourselves around climate and the need for action in this area has to do with economics and the way we conceptualize GDP and, you know, what growth is really and the importance of economic growth. I'm wondering if either Rebekka or Sona, if you have a response to that.
I can start, Hannah. I mean, I suspect that Gary's right, and that certainly plays a role in basically how our upstream kind of structural drivers are definitely construct conditions where we see the unequal distribution of resources and power and money. And I think that the more we understand how those kind of processes all work, and it is very complex, but I think some of the frameworks that were presented today can really help kind of provide that conceptualization. And once we see those areas, then we can kind of better understand where the need for upstream interventions are as well as downstream interventions.
Yeah, happy to share some perspectives here as well. I think it's a great question. And I think one thing that we at Greenlining are really trying to push against is this idea that, you know, a program may benefit all communities, but it will prioritize more wealthier white communities first, and then others will receive the same benefits through, you know, trickle down economics many years later. And we really want to push back against that narrative and prioritize communities who have been left out from these opportunities that are being hit hardest by climate change to be at the forefront of receiving those benefits, and really rethink how we, you know, have them take ownership over programs and give them power to be able to impact policies that are going to affect their lives. And through our work, as I mentioned, I'm on the environmental equity team, and what that really means is that not only are we trying to take the bad out of communities, as in toxic air and water, but also find ways to bring the good into communities, and that is really focused on economic opportunity. As we want our communities to not only have healthy living environments, but to be economically thriving as well. And all of our work is at the intersection of environmental and economic justice, recognizing how related they are. And on this topic, I think one of the challenges we face is that even as we are prioritizing investments and really targeting funding into marginalized communities, we have to make sure that that investment is provided without the threat of displacement, because as communities get investments for bike lanes or public transit or affordable housing, it's often at the threat of them being displaced due to increased housing and cost of living in that area, and not being able to benefit from those investments. And so the program that I mentioned earlier, the Transformative Climate Communities Program, has a requirement for the grants to include anti-displacement provisions and mechanisms from the beginning to make sure that the communities that those investments are intended for are the ones benefiting from it.
Thanks, Sona. Yeah, and just to add, I did share a resource from the National Collaborating Center for Healthy Public Policy in the chat box on what's referred to as ecological economics. And that's well worth reading. It's sort of adapted interview with other references and questions and responses with Trevor Hancock, who many of you will know from the Healthy Communities movement, from current planetary health action, and from public health awesomeness in general. So it's worth reading and sort of also builds on some of those ideas around, do we really need to use GDP, and how can we rethink economics? I just want to move to two questions that I think I missed in my previous little spiel for Rebekka. Rebekka, I'm wondering if you were able to touch on this, or if you can touch on this at all. And then if others in the line have anything to add that they can write in the chat box in response to this question, that would be great too. So Tracy, from, I believe, the government of New Brunswick, says that VNAs benefiting from equitable participation, and I think she means to say VNAs benefit from equitable participation and diverse voices. And she asks, during the pandemic restrictions, are there any suggestions for involving vulnerable groups safely? We had big plans in New Brunswick, but feel we will need to modify approaches due to public safety. And so I wonder, and I think that some of the answers to this question could come from anybody on the line who's able to write about this in the chat box too, that has been engaging with communities meaningfully, even if not for climate action, because it's that how do you do community engagement virtually in a good way, although Tracy's question is certainly more framed within the context of engaging for equitable adaptation purposes. So Rebekka, if you have anything to add there, that would be great, and I'll just turn it over to you.
Thanks. Yeah, I mean, thanks, Tracy, for bringing this up, because I think it's a major challenge for a lot of people right now. Like, as we all know, the pandemic has kind of compounded a lot of challenges around climate change and health already, and highlighted these health inequities certainly. In terms of actually engaging with communities, normally I would kind of suggest exploring what kind of collaborative partnerships are opportunities there are with kind of community-based organizations that are already working with different populations, different communities and neighborhoods, because they're already interacting with these various groups, but recognizing, that they're already at capacity and often strained with the pandemic response as well. But I did see in the chat box that there was some kind of discussion going on about some, I think, interesting options and kind of creative ways that different people are doing this. So I'll just echo what Pema said, and because this is a major challenge that I think even our team is still trying to figure out how exactly to do meaningful engagement in a safe way that doesn't rely just on the virtual space. So if there are any kind of creative solutions, or if other people have comments on this, I'd certainly be interested in hearing about it.
Thanks, Rebekka. There's also a question which you may have been able to comment on, within the chat box, and I might have missed it, on whether or not, it's from Niagara, from Jacqueline Gates in Niagara region. And she says, we are currently piloting health impact assessments in our planning and environmental assessment processes. Has anyone integrated VNAs and into the health impact assessment process? So if others on the line have any comments, feel free to write about that in the chat box. Rebekka, if there's anything additional you want to add, go for it. And Sona as well, I mean, you have interactions with people doing assessments from the U.S. context, which probably can help to inform things over here as well.
Yeah, thanks, Emma. I'll just say I'm not as familiar with health impact assessments, so I don't think I have an answer, but I also saw, I think there was some good conversation around this in the chat box too, so I'm, listening and learning as well today.
Great. I'm wondering, Sona, you shared something with me, and it's not a direct answer to that question, but I'm wondering if people on the line might be interested in hearing about it, about movement towards, where you are, movement towards putting both a climate and health lens on various different policies. And it's similar in my mind to what, health impact assessment and policy, when you pass a policy, having to do a health impact assessment might be. Do you want to comment on that? Sure. Yeah, and there are, as I was doing some research for our report, there are examples from states in the Northeast that have done that kind of intersectional health vulnerability assessment with a climate lens that looks at vulnerable populations as well. And so I'm happy to follow up and share some of those frameworks if it's helpful. And then in terms of the work we're doing, yes, I think we absolutely want to be sure that we're thinking about public health as it relates to climate resilience and the work we're doing on the environmental team. As we've gone through these presentations, it's so clear how those two areas are intersectional. And what we're trying to do is, as we, especially during COVID, kind of seeing how that can be extremely harmful for communities to be facing COVID, a public health threat, in addition to so many climate disasters. As I mentioned, this Office of Racial Equity legislation that we're hoping to pass in California, it will include a health screening tool as well, so that essentially there's multiple screens that will be applied if this passes for any existing legislation. And those would be a health equity screening to see how is this policy potentially burdening or benefiting marginalized communities, a climate screening to know how is this policy or plan going to increase vulnerability to climate change or reduce it. And then at the same time, there will be this racial equity screening that will take place to see in general how is this policy or plan creating new racial disparities or mitigating them. And I think the goal there is to, at the beginning, be asking those questions so that we are not left with kind of unintended consequences of a policy many years later throughout implementation. And the more that we're explicit about it at the beginning and intentional about it, we hope that we can make sure we're able to course correct as we continue to develop a policy or implement it. And so this is a pretty new idea, and I think it will definitely be an uphill battle to move this forward, but it's one that we really think is necessary given the extreme amount of anti-Blackness and other forms of racism that we've seen in the U.S., not only in this past year, but for the past centuries. And we're hoping that this is one way to begin thinking about how those three topics, climate, health, and racial equity, are intersected, and how can we find solutions to advance all three of them at the same time.
Thank you, Sona. I can't think of a better way to end this webinar than on that note, finding solutions to all three at the same time. Thank you very much to everybody who has participated in this webinar, especially our presenters and partners at Health Canada and Greenlining. It's been such a pleasure to work with you. There's been some great chat and resource sharing happening in the chat box. So we'll make sure to follow up with everybody with a better synthesis of what's been shared. I just want to flag, because I meant to earlier and didn't, but I've put some links in the chat box to the Canadian Journal of Public Health special section on moving on IPCC 1.5 degrees Celsius. So really that's a special issue on climate change as a top priority for public health. And I was really impressed by the level of scholarship and the diverse sort of topics and ways of thinking that were shared within that special section. So if you haven't had a chance to read it, I really encourage all of you to go check it out. And I've put some links there in the chat box. So on that note, we have another webinar coming up on January 29th on the health equity impacts of a changing climate part 2, communicating and change making. And for that webinar, we are happy to have Courtney Howard, past president of CAPE, the Canadian Association of Physicians for the Environment, and also former, she ran for the Green Party and in general is a great health advocate and speaker. So we're looking forward to having Courtney there, as well as Helen Doyle from the Ontario Public Health Association, and she'll share about a current campaign that has a health equity focus and is about climate change and the health effects of climate change. So you can sign up for that webinar. There's a link on our slide there, and of course you can contact us anytime. There's an email address there for the NCCDH, and if you ever are looking for me, that email address will of course take you to me through somebody else. I'm Pema Mazumdar, and I'll put my email in the chat box as well. Take care to everybody. Thank you for joining us, and thank you to our presenters.